It's 4:33 right now here on the old drive home, and took a little long to get Movie Mania going there.
It did. You picked a difficult movie.
I did. The Specialist by Sylvester Stallone. A little bit before your time, Dr. April Ritz.
Yep, haven't heard of it.
All right. Sharon Stone's in it.
It's way before my time, too. Don't.
What? Also,
I thought I'd
no,
say
it wasn't that.
No.
Stop it.
Eric, what's it? Pretty Woman. The girl in Pretty Woman. What's her name?
Julia Roberts?
Julia Roberts?
Yeah, Eric Roberts is the bad guy in the movie.
Oh.
That's right.
Okay.
And always liked him. He plays a great bad guy.
Yeah.
He's never played a good guy, maybe once in his life. He's always a bad guy.
Sorry.
So it's all good. But he seems like a nice guy.
Oh,
Anyway,
sure.
Dr. April Ritz in the house. We're on Facebook Live. Check it out if you wish. What's
Okay.
going on with you? Menopause, right? Tell me all about it.
Let's just
Well,
jump
not with
straight
you.
in.
Well,
but-
Topic
That's just like an awkward question. Menopause, right, April? No.
Well, I'm not quite old enough for
Yeah,
that.
you're not quite
yet.
Hey, what's
Hopefully
the-
not for a while.
What's the earliest you've ever heard of anybody actually going through menopause?
Well, you can have premature menopause or like ovarian insufficiency, primary ovarian insufficiency, and that can actually happen in the 30s. But we don't like to see that. So yeah, typically in the 40s is when perimenopause symptoms start to happen, and then average age of menopause is around 51.
Yeah.
Okay.
I was listening to a podcast actually recently though, and they're saying menopause was actually the term was coined back in the 1800s, and back then all women had to at some point their menses would just naturally stop. There wasn't hysterectomies back then. There wasn't uterine ablations and things like that.
Oh,
but they're
wow.
actually talking about the definition needs to be changed because nowadays the true definition is the cessation of your period for 12 months. Well, a lot of women nowadays are having hysterectomies or uterine ablations or, different things that are ending their period. So it's like, when does that actually really
Oh,
occur?
yeah.
Right.
Interesting.
Yeah.
And where's the name come from?
I did research from last time.
You're
I
the
like
girl.
her definition better than yours.
Oh, I'm sure
because
it is.
yours
I'm sure
it's
freaks
better.
me out.
So menopause, two Greek words. Meno for month. So like menses,
Yeah.
having your period monthly, menses. And then pause, cessation or ending of.
ending.
So
Oh.
it's really like the ending of the month, ending of the monthly cycle.
Sure.
Okay.
Yeah.
Thank you, April. I like that.
That makes
better.
perfect sense. I figured it was probably something like that.
Much more logical.
I was grasping at straws on the other one.
No, we are not. We are not turning into men.
Oh my God.
It's not a give it a shot,
Yeah.
But, back in the days, people, they didn't realize what caused all these things. I figured maybe some crazy crackpot was like, well, you're just becoming a man. That's all it is.
Well, there's a picture probably of you because
Oh my
The crazy
goodness.
crackpot. There you are.
Yeah.
So anyway, enough about the crazy stuff,
Oh,
but
my
you
gosh.
do a lot of work with women who are having in menopause, don't you?
Yeah, so perimenopause and menopause, and specifically, we have a class coming up here at the end of February. Tiffany Mosley, she is a midwife and advanced practice nurse. She was actually going to be with me today on the radio, but she is helping a baby be born right now,
well,
so
good for her.
Yeah.
so she can't join me, but she does.
You mean to tell me she couldn't say, can you just hold on a
Hold
minute?
off on that
I got to go
baby."
be on the radio.
Yeah, you might be 10 centimeters, so just give me a little bit of time. No, she deals more with the hormonal aspect, and that part of it. I can't address the hormones. I can't prescribe medications, but we deal more with the genitourinary symptoms of menopause. So for a lot of people, this is when they are going through this period, they're going to have a drop in estrogen, and they're going to they may, not always, they may start to notice symptoms of vaginal dryness, pain with intercourse, worsening of prolapse symptoms like pelvic heaviness, incomplete bladder emptying. They may start to have some urinary leakage or even bowel leakage at this point. And that's where an approach comes in where they're working with their doctors on some hormonal issues and then also working with us for this like muscular issue. So everybody too thinks estrogen is like estrogen creams and hormone replacement therapy is a really bad thing. It's really not. There's a lot of like misinformation out there.
Really? Very
Okay.
nice.
And estrogen is actually very important for our brain health. It is important for our bone health. It is important for our skin too. So some things people may see is memory issues, difficulty remembering things.
Oh yeah.
Dry skin problems, In addition to like and then like, mood swings, hot flashes, the common symptoms. But not everybody experiences those. So each approach is individualized.
Everybody's different. You're trying to
Yes.
say there. Exactly.
He keeps pointing at me. Right?
I see him.
I know.
In the corner of my eye. I see him pointing.
Uh-huh.
But,
Maybe for the mood swings. I don't know.
But, I mean, and you could try to take care of these on your own, but it's like, man, if you had some, doctors to tell you, maybe clue you in a little bit on this, might help a little bit.
Yeah, you can follow as many people as you want on social media. You can try to do your own Google research, but you really need a team that knows what they're doing.
I think that's a great idea.
And I'm gonna throw this out there too. When it comes to pain with intercourse, regarding postmenopausal pain with intercourse, there is 34 differential diagnoses that it can be, and so
34.
There can be up to 34 different things that can be going on causing pain.
My goodness.
Oh my
So
gosh.
And a lot of people just think, okay, I'm gonna go to my well women's visit. I'll talk to my doctor about all these things. The doctors only have like 10, 15 minutes with you. They can't dive into everything. And that's where we come in our clinic. We do 2-hour evaluations for pelvic pain. We have time to listen to the history. We have time to do a thorough exam to really figure out what's causing your pain issues.
My gosh,
So
34 different things. Give me a dart. Okay, there it is.
Wow.
So
what
we
would
really
the
need to-
worst one be? Because if someone were to Google it, they would look at the
Yes.
worst one and it would be like the worst one. That
Yes.
it's probably not it, but it could be.
I
not
find
saying
in the
it is.
clinic one of the most difficult conditions to treat for pelvic pain is vulvodynia, which that is just kind of Let's go into anatomy
There you
into
go.
our words and meetings.
That's why we
here.
love these shows.
It's Greek.
So vulvar and dynia is pain, so pain in the vulva region, and there can be underlying issues of what's causing that. Is it an autoimmune issue? Is it skin sensitivity? Is it food issue, like what you're eating that's causing some of this inflammation? So getting to the root cause for that can be difficult.
Yeah.
All kinds of different things. So good to know there's people around who we can go talk to and get those taken care of, no doubt about it, and figure it out, because that can be quite a puzzle to try to figure that out. I know you do all these classes and stuff, and you teach people about this and that. You got anything happening here in the next little while?
We do. So last time we just had our postpartum rehab class. We had 5 women come to that, and it was great. We have another one coming up in April for that, for any moms that are pregnant or just postpartum. Next week on Tuesday, we have our low tox living. So we're going to be talking about how to reduce environmental toxins in your home.
Oh, yeah.
So from Bath and Body Works candles, they're really not good. Did you know some of their
Don't
products?
tell her that.
Oh my
Okay,
gosh.
yeah, I hate to burst your bubble, but some products literally say this could lead to infertility on some of their stuff.
Well, that's not good.
Well, that's not a big deal.
there-
Well, you're fine.
I mean, let's just face it.
Hey, maybe that's why you're not right now, okay? No, I think that most pass.
Candles.
So yeah, candles, they can
Really?
the fragrances are endocrine disruptors. So we'll be talking about from candles to laundry detergents to products you're cleaning your home with. Especially this is a big important class for a lot of moms because they're wanting to reduce toxins in their home
Oh,
that
yeah.
can affect children, because one of the leading causes for children consuming things and getting injured is from cleaning products. So let's get rid of all the bad stuff in our homes and have cleaning products that aren't going to hurt our kids if they would get into them.
Very interesting.
So yeah, that class is next Tuesday. It is a free class, but you do have to register for it because we want to make sure we have enough seats for everybody coming. So registration for all of our classes, you can call our clinic or go onto our Facebook page. But that one's coming up, and then the following week on Tuesday is our menopause class, perimenopause and menopause. That class is $25, and it's a 2-hour class, 5:30 to 7:30. And then the following week on Wednesday, we have a class on irritable bowel syndrome and the pelvic floor. And we'll be having a dietitian who specializes in IBS come and host that class with me at the clinic. So,
That'd be great.
yeah, everything can be found on our Facebook page.
I mean, you guys just do these all the time. It's like, you have your 9 to 5 job, and then you
Yeah.
have your class job.
Right.
I asked earlier today, these people that came in, were talking at 12:30 about what do you do in their spare time. They said, well, we don't have any. I'm guessing that's you as well.
I hang out with my kids in my spare time.
Yeah.
That's
But yeah,
good stuff.
I don't have a lot of spare time.
But that is a great thing to do with your spare time, is hang out with your kids.
Yeah.
You got quite a crew there, no doubt about it.
yeah.
All right. So you hear about all, say if somebody's out there and they're experiencing some discomfort in that region of some sort, you
Yes.
could probably help them out. You don't have to put up with this pain, do you?
Correct. So whether it's back pain, hip pain, pelvic pain, anything in that area, abdominal pain too, we treat all of that. So you can call our clinic. We do not require referrals to be seen. Our number is 217-705-5077. Feel free to look at our website, check us out on social media to kind of get our feel for our clinic.
I love it.
And
Very
if
nice.
you mentioned, if there's some things treatment-wise regarding hormonal applications and whatever, then you may have a person that you personally say you're very confident in getting some help from. Tiffany, I think you said.
Yeah, so Tiffany Mosley, she is a midwife, and so she is great. And then we work with a lot of local providers on hormone issues too. So, yeah, we have contacts for a lot of different things.
All right, good connections.
I like that.
Yes.
I like that network. You all network together to help.
Yes.
The thing is, you want to help the patient. That's the main thing.
Yeah, and we can't all do everything. We all can
No.
treat in our own little areas. So,
That's awesome. Very good. Well, what are you
That's
gonna do?
very good.
What are you gonna do on the rest of a night like this?
go grocery shopping and then go home,
Gotta
have some
eat.
dinner, hang out with the kids
Sounds like a
and my
plan.
husband.
Oh, he's invited
Yes,
too, right?
yes.
Yeah, he
Oh,
makes the
yeah.
dinner.
Oh, very nice.
All
Wow,
right.
even better.
It's great.
About time.
All right. How is he? Pretty good cook?
Oh yeah, he's good. I
Oh.
do the meal prepping, I do the grocery shopping, and he makes the food.
Oh, that's a
So
good.
I have yeah.
Fettuccine day.
That's a good trade right there.
Yes.
You're having something good you mentioned, so good
Yes.
luck on
Oh,
that.
yeah.
If you have any leftovers, feel free to bring them back
We
tomorrow.
won't. We won't.
It won't
Yeah.
be very good. Well, Dr. April, always a pleasure having you here. You do such fine work around the area. Keep doing it, okay?
Thank you.
All right, stick around.